Thank you. Thank you guys. Thanks for having me here today. That was just a wonderful presentation as well, and really sets up, this presentation looking at medical cannabis and the endocannabinoid system and how we can leverage these tools to actually create personalised medicine approaches and working together in a collaborative way to have really interdisciplinary sort of healthcare, which is the gold standard really of healthcare. Oh, too far. So look, a little bit about me. I'm a GP. I was just working in a regular GP practice, but I always had an interest in complex and chronic disease management, and the tools that we as GPs, are taught and have available to us, are generally single molecule drugs that work on certain components of physiology that don't necessarily look at the person in their entirety. And I was, had a lot of treatment-resistant patients who had tried all the different tools that I had, and every time I added something in, I was often only partially resolving the primary complaint, but actually increasing morbidity to their system with the side effects and the polypharmacy that often came along with that. And I was lucky to be in a practice, in the early days of medical cannabis where there was another GP who was already prescribing. And the first patient I treated was a returned veteran, mid-30s gentleman who was, built and fit and looked healthy from the outside, but he was carrying so many wounds from his trauma in the special, in special forces. He'd been shot in the chest and he'd fallen 10 metres with heavy pack, and he had central sensitization issues, he had PTSD. He was really struggling to, integrate back into civilian life. Here in Australia, he was leaning on alcohol, he had a young family, and he was unable to connect with them in a meaningful way. And he'd tried everything, he'd been to every specialist. And I, in a leap of faith, I provided him with a balanced oil of CBD and THC at night time and some CBD throughout the day. And the impact was profound. It improved his sleep, reduced his nightmares, his hyperarousal, his central sensitization dampened down. It didn't get rid of his symptoms, but it worked across a range of these different areas, and the overall improvement in his capacity was wonderful. But at the time, there was very little education around cannabis, and I wanted to know why it was working so well for this patient, and then there were other patients I was treating, and the response was variable. And so I've been on a journey to try and understand this plant and how it sort of works across a range of different conditions for years. I had a desire, at the start of COVID to open up an interdisciplinary health clinic, which was looking at supporting the endocannabinoid system through this holistic sort of healthcare model. I wanted to work alongside a psychologist, osteopath, Chinese medicine and acupuncturist, but COVID struck and put those plans to bed. And my own mother actually got stage 4 pancreatic cancer at the start of COVID. So I moved down to Victoria where she was with my young family, got there 2 days before the borders closed. And I was lucky to be in a situation where I had these tools that a lot of other doctors didn't have to help her through that journey. But looking into the research around cannabis, it's a complex herbal medicine, and there was so much more that could have been done to create more specific and targeted treatments for mum, but also my other patients. So I since then started a product company called Heyday that was about developing new and novel and differentiated sort of cannabinoid medicines for a range of different conditions. And recently we were acquired by one of the bigger product companies here in Australia. So I'm working as their Chief Medical Officer, creating new medicines, but also doing a lot of education, creating clinical resources for doctors and other healthcare professionals as well. So that's a little bit about me. And today, I'm going to talk, through a range of different things, but really wanting to start at the foundation of the body's own endocannabinoid system. So we all produce cannabinoids ourselves. The endocannabinoid system is, spread throughout all of our cells and tissues within the body, and it's there to regulate and fine-tune our response to both internal and external stimuli. Keeps everything in check and balance. And we'll look at how it sort of is involved in chronic pain, what are the health promoting activities and different sort of modalities and how they influence this endocannabinoid system, looking at cannabis and phytocannabinoids as these exogenous compounds that can impact this internal regulatory system, and then its role in chronic pain, and we'll look through the different types of cannabinoids because cannabis is not all one thing. It is a range of different compounds, formulations that can be used in different ways for different conditions. And we'll look at the evidence that's out there as well. So what is the endocannabinoid system? And I'll ask for a show of hands. Who's heard of the endocannabinoid system? I would not get that same response if I was in a room full of doctors, I have to say, which is absolutely wonderful. But the endocannabinoid system is really our master homeostatic regulatory system. It's in all of our cells and tissues, and its role is to fine-tune our response to changes. It's an adaptive system that allows us to respond appropriately to stimuli. We have these networks of opposing systems within our body, and they need to work at the right volume or intensity to make sure that we have an appropriate response. If there's too much inflammation, that leads to tissue damage. If there's not enough, we have infections and other issues. And it's an ancient system within our bodies. It's one of the foundational systems that has allowed all of our other complex physiology to be layered on top of it to allow us to have these amazing bodies with this amazing capacity, because it is fine-tuning and regulating these processes. It's a cellular communication network that works locally. It's the cannabinoids are produced on demand from the cell wall. They work with the cells around where they're being produced, and they work on self cells as well. And it's not just working with the cells around it, it's also intracellular as well. There's cannabinoid receptors within the organelles, within the cell, affecting the mitochondria and cellular respiration and cell turnover as well. So as I said, it's this bidirectional system. It's present and active in opposing networks throughout our body. It has this neuromodulatory effect. So, a lot of our conventional neurotransmitter systems, they have these downstream effects. There's a release of neurotransmitters, they activate a neuron, and it has a response that heads on downstream. With the endocannabinoids, they actually are there to work locally in a retrograde manner, and they start dampening down in a negative feedback sort of way to reduce those stimuli and keep them in check and balance. But it's there to regulate our mood, our stress, our sleep, our digestion, our inflammation, immune function, pain, digestion. So it's integrally involved in all physiology. And you think, well, if it's such an important system, well, how come we don't, talk more about it? As you're probably all aware, it takes quite a long time for things to be known as truth within research and medicine to then get translated into clinical practice. And the endocannabinoid system was only identified back in the late 80s when they were trying to figure out how THC caused its intoxicating effects. They thought at the time that THC was likely disrupting the cellular membrane and caused alterations in how the cells work through that way, but they actually saw that these compounds were binding to particular receptors on the cell wall. So they found the cannabinoid receptors, and then they found the endogenous ligands that actually were binding to these. So looking at the structure of the endocannabinoid system, and this is the structure of the classical endocannabinoid system, the reality is that there is actually a more complex array of receptors and endocannabinoid-like compounds, different congeners like PEA as well that are produced at the same time as some of these compounds as well. But the core components, the CB1 receptor, is primarily in the central nervous system, so within the brain and the spinal column, but they are also in peripheral tissues as well. The CB1 receptor is the most abundant 7-transmembrane G protein coupled receptor in the brain, and that's the predominant type of receptors that we have in the brain. It's 10 times as abundant as the opioid receptors within the brain. So for a neurologist to be an expert in their field, they really need to understand the endocannabinoid system. It's influencing all of the other neural networks that are there, the other neurotransmitters and the other feedback systems that they have. But the knowledge, unfortunately, is still quite limited. We have the CB2 receptors, which is predominantly in the immune system. So it's it is there as an immunomodulatory sort of receptor, dampens down inflammation, reduces a whole range of processes that can help with chronic pain, but also a range of other conditions. The ligands, they're lipid signaling ligands that are produced from the cell wall from arachidonic acid, so omega-6 polyunsaturated fatty acid precursors. And anandamide was the first identified endocannabinoid. And ananda is the Sanskrit term for bliss. So it is this bliss compound, and the runner's high, that a lot of people experience when they do enjoyable exercise is primarily mediated through anandamide and these endocannabinoids. And then we have the enzymes that make them and break them down in this really dynamic process that's activity dependent based on the cell being activated, and then there's a response and a fine-tuning process. So as you can see here, unlike conventional neurotransmitter systems, there is an activity of a neuron. The endocannabinoids are created at that moment in time from the cell wall. They're released back into the synaptic cleft. They work on the sort of presynaptic sort of neurons to dampen down and fine-tune that response. And they're doing that for all of these different neuronal networks, but not just at the nerve level. It's in all tissues within the body. And even though the exact activity is different at all of these areas, the role is generally the same, and that's to create homeostasis and balance within these tissues. So as you can see, in different organs in different areas of the body, these are different sort of components of endocannabinoid function, and it is wide, it's varied, but it is all very essential to health and well-being. So when looking at pain, as it's been identified here, pain is not just a physical thing. It does not just affect one part of our physiology. It's not just an inflammatory thing. It's not just nerve damage. It's not just a subjective experience of damage. It is affecting people's whole entire sort of health and well-being, the way that they view themselves and view the world around them as well. And so when treating pain, we need these tools that actually look at all of these different areas and to actually make a meaningful impact on someone's pain rather than trying to target and isolate one part of the pain pathway. We don't get the results that we should when we're looking at that approach. So, in regards to the endocannabinoid system, it's involved in peripheral inflammation. It's involved in the central sensitization and peripheral sensitization of nerves. There's activation of the endocannabinoid system leads to activation of these descending pain pathways, which then regulate that pain experience. But one of the biggest things is the subjective experience of pain. So a lot of my patients, when they're using cannabis, they might say, yes, the pain is lessened to a degree, but the biggest impact they have is that they are no longer as bothered by their pain. So the pain interference is less. And that gives them better capacity to start engaging in other therapies that are going to lead them to a state of health and well-being. There's less fear and avoidance, there's less distress, and that makes a huge impact. And as previously mentioned, these other comorbid sort of expressions of pain around sleep and anxiety, they can be modulated as well when using these tools appropriately. So, you don't need cannabis to influence the endocannabinoid system. The endocannabinoid system responds to a range of different health-promoting activities. All of you here in this room, part of the benefit that your patients are experiencing through your treatment modalities is through the support and upregulation of this endocannabinoid system network. So exercise, has been proven to increase the tone of the endocannabinoid system, but the interesting thing with this system is it responds to enjoyable activities. So a lot of my patients, I think, they've had this chronicity and complexity around their sort of their disease process, and you say, I need you to do exercise, or I need you to engage in physical therapy. And a lot of the time they have done that in the past, and that's caused some level of discomfort because they've got this hypersensitive nervous system and these other sensitization issues, and they fear it and they avoid it. So I try and get them to engage in joyful movement. and whatever that is, if you can get them dancing, if you can get them doing yoga, if you can get them walking out in nature, you get them rolling, I don't care what it is, but as long as they're moving and they're having joy while they're doing it, turn the lights off, put the music on, dance around in that is really an important part of it. So, you tell people, I'm not trying to cause you pain or distress. I want you to engage in activities that bring you joy. Can we do that? How do we work towards that? What would work for you? Because it needs to be a personalized approach. Acupuncture has been shown to some of its benefits in regards to pain have been through upregulation of the endocannabinoid system, and blocking the CB2 receptor has stopped those positive effects in regards to pain and inflammation. Massage and osteopathy have also been shown to upregulate the endocannabinoid system, and with those with low back pain, it's not just the traditional endocannabinoids, it's actually increasing the endogenous PEA as well, which we spoke about as a nutraceutical, but our bodies are producing PEA all the time as well. The PEA is produced at the same time as anandamide through that same arachidonic acid pathway, and it is an amazing entourage compound that works really well alongside cannabis-based medicines as well. Omega-3 supplementation, we've already spoken about that. Look, we all are aware here that our diets are filled with excessive amounts of omega-6 essential fatty acids through just the wide use of seed oils in many of our processed sort of foods. Even though our endocannabinoids are derived from these omega-6 essential fatty acids, we need to have a balanced system, and the omega-3 essential fatty acids are the regulating component to the body's own endocannabinoid system as well. So increasing our omega-3, through diet and through supplementation can have a profound impact on people's health across a wide range of areas, because it does support this endocannabinoid system. And, we have more microbial DNA in our body than we do human DNA. And the endocannabinoid system and the microbiome, they have a really strong cross-linking effect. If you have a dysregulated endocannabinoid system, that actually promotes dysbiosis and a dysfunctional microbiome. If you have dysbiosis and a negatively a poor, low diversity microbiome, that leads to challenges in the endocannabinoid system as well. So it's important that we don't do any of these treatments in isolation, because they all need to be done together for those treatments and modalities to actually stick as well. And, the reality is that, all chronic disease states are a breakdown of these complex, I lost my mind, there we are, back up again, interconnected biological sort of processes. And, in regards to cannabis as a treatment, for my colleagues, the classical heart sink patient, the one that returns week after week, trying everything but getting nowhere, they're the ones that actually respond really well to cannabis as a therapy, because of how diverse the endocannabinoid system is and the modulating role that we can influence by using these tools. And so it may not be the best treatment for pain, even though it does have some pretty good evidence. It may not be the best treatment for sleep. It may not be the best treatment for anxiety, but it's generally safe. It's very well tolerated for most patients. And if you can have a 20% reduction in someone's pain, you can have improvements in their sleep, you can reduce their sympathetic stress response, improve their anxiety in some way, that leads to a huge improvement in their quality of life and their capacity to start engaging in other wellbeing practices. And that's where the real journey begins. And, some of the biggest issues we have in modern healthcare is polypharmacy-driven or iatrogenic illness. That's actually what we're trying to do to treat people, is actually making them sort of worse. So reducing that burden of polypharmacy and actually taking out some of the most problematic medications that people are generally using to alleviate their suffering and distress. So reducing the need for opioids, reducing their needs for benzodiazepines or other hypnotics, reducing their need for neuropathic pain medication. Being able to get rid of some of those medications gives patients a huge improvement and boost in their quality of life as well. So when I know I've spoken a lot about the endocannabinoid system, but really when I use cannabis, or now when I just approach any patient with any tool that I'm trying to implement, I do it really through the lens of the endocannabinoid system. And I think in a way it's a cheating way to actually provide holistic healthcare. I've done some training in integrative health, and I'm enrolled in the Academ sort of fellowship, but you go into the detail around some of these, systems like the methylation process or whatever it is, and you can get really caught and bogged down in that minutia and that detail. This is a zoomed out approach to actually provide some holistic approach to health. I don't need to know how to influence every system in the body if I can influence the regulatory system of the body. So if I can improve the endocannabinoid system, the body has its own intuition and capacity. It knows what it needs better than I do. I just need to support its capacity to do its job better. And so you don't need cannabis, diet, exercise, connection, music, art therapy. I think the modality that's been proven to upregulate the endocannabinoid system more than anything was singing in a choir. Obviously, you need to like singing and you need to like, being in a choir, but that sort of communal, social, expression, the music, it actually is that whole. It elevates people, and that is a medical intervention and treatment. So there we go. Look, and I think I think a lot of patients think if they're doing something that brings them joy, there's this weird mentality that we have. If it doesn't have a sort of productivity or an outcome sort of focused sort of goal, most people think that they're doing something sort of luxurious or whatever it might be. But engaging in joyful activities and meaningful social connection is what is going to primarily influence someone's health in a positive way. But for a lot of our patients, they've been unwell for a long period of time, and even though they know what they might need to do, they can't get there because their symptoms are too challenging. There's too many barriers. There's a lack of motivation. There's fear and avoidance. They're stiff. They're fatigued. So using something like cannabis or any intervention, it shouldn't be the primary endpoint. It's just taking away some of those barriers that are stopping people from engaging in these activities, and that's the treatment. The activities and the modalities that you guys are introducing. Pardon?
What method are you talking about? Is it something that they take in or smoke it?
Yeah, so we will go through that, but look, it's often a combination. So the oral dosed cannabinoid therapies are like a baseline therapy. They're a long-acting sort of therapy, and then you can use the inhaled cannabinoids for instant relief, which can be to improve flares of their condition, or you can use them preemptively before a challenging situation. So if someone responds well to cannabis-based therapies, they're going in to do a physical manipulation or physiotherapy, they can preemptively use some inhaled cannabis that allows them to soften, relax, allows those therapies to actually have more of an impact with less distress. So it's often a combination, and it's not just one long-acting and one inhaled. It's often looking at it through a daytime lens and a nighttime lens, because our functional goals and our needs vary quite dramatically depending on what time of day it is, what the cognitive load is, how much executive function they might need for their activities during the day. Obviously, we need to be focused, switched on, and alert. But at nighttime, we need to be putting down our stresses and our worries, actually trying to get to, quiet the mind so that we can actually sleep appropriately. And different cannabinoids are going to be better suited to those different times of day. So, what is cannabis? Cannabis is a complex herbal medicine. It's not a single compound. It's not a single drug. It is hundreds of very biologically active compounds working in concert, working in synergy, and really the potential medical applications is really diverse depending on how you arrange these different compounds. You know, the cannabinoids might be one of the powerful sort of drivers, but then you have all of these aromatic compounds like the terpenes, which will dictate the mood, so to speak, of the medicine. So you might have a product that has the same amount of THC or CBD, but because of the other companion compounds that are in there, some will be uplifting and energizing and mood boosting and motivating, and others will be relaxing, sedating, calming, and have a stronger analgesic profile. So it's looking at all of these constituents, and that's when you can actually create a personalized plan, which we don't get with many of our single molecule sort of drugs. And you know, it's not a new medication. Cannabis was probably the first domesticated plant that we had as humans, and you know, it sort of developed about 28 million years ago in the Tibetan Plateau, but it has spread to all corners of the globe in some way or another because of its importance to our human ancestors. They took it with them wherever they went. You know, there's ancient burial sites of shamans who, you know, get buried with their most important possessions, and it's often, you know, there's cannabis seeds and cannabis fibre in these. A lot of ancient burial sites across a range of different cultures. You know, all of, you know, there's you know, documented evidence around cannabis being used in ancient Chinese civilizations, in Egyptian, in Syrian, in Roman, in Greek, and in the 19th century as well. In our recent history, cannabis was probably our most widely used medication for about 100 years, for over about 100 different conditions, and there was really solid evidence at that point in time, and really it was not taken out of the medical realm because of it's for medical reasons. It's all been other political and other ideologies that have actually had it taken out of our you know, pharmacopoeia. But we are getting it back, and it's an exciting time to see this re-emergence of cannabis therapies. So the main cannabinoids, the two primary cannabinoids, are CBD and THC, and they're quite different to each other. But as I said, there's a whole range of other compounds within cannabis as well. And my real special area of interest has been in these minor cannabinoids as well. Things like CBG, CBC, THCV, CBDV. These can be used to create more targeted and specific medications for each individual or the different types of conditions that they might be experiencing. So, you know, THC is the real outlier in cannabis in many ways. It's probably the most powerful compound we have within cannabis, but it's also the one that has the highest risk profile, and it can cause intoxication and impairment at the, you know, for people, and if overused, which, you know, it can actually downregulate the endocannabinoid system. All of the other compounds are non-intoxicating, they're very functional, they have a wide range of potential sort of benefits, and when used together, they can actually create quite powerful tools in and of their own right with a much lower risk profile as well. So looking at THC, though, like I said, this is a bit of an outlier, but it's also what most people associate with cannabis. THC is, you know, the primary compound that gives the effects that most people associate with cannabis. So that intoxication, that euphoria, the relaxation, the laughter, the appetite increase, the sedation, all of these features are related to THC. Because THC actually has direct binding activity of these traditional cannabinoid receptors, it has bidirectional effects in and of itself because it's working through a balancing system. So the right amount of THC can help with relaxation, can help with sleep, can help modify pain. The wrong amount of THC can do the opposite. It can lead to agitation, it can lead to hyperarousal, it can actually, you know, sometimes make people more aware of their pain as well. So it's all about getting the dose right and engaging in a slow and mindful titration to get to that right dose, and there's a real therapeutic sweet spot for most people as well. So, you know, people say, you know, there's studies coming out, you know, there might be studies that say cannabis is ineffective or cannabis has these things, but it's about how it's applied, and it needs to be done on an individual basis because there's a huge amount of interpersonal variability, and so the dose for one individual, even if they have a very similar presentation, is going to be very different to another. You know, I'll have big, strong, burly, gentlemen who require microscopic doses of THC to have a profound effect, and I'll have 50-year-old, 50-kilogram, elderly women who will have large amounts of THC to have that same effect. But even though the dose can't be predicted at the outset, the dosing response is the same. As you start low at a subtherapeutic dose, as you slowly increase it, you'll start getting increasing benefits, hopefully, and there will come a point, the tipping point, where you no longer get any benefits and you start getting side effects. So most people won't know exactly where that is, and it's okay if they, go to the point of intoxication. Generally, most people like that experience, but it's not what they're aiming for on a daily basis, so you just reduce the dose once you figure out where that point is for them. But it's not just acting through these cannabinoid receptors, it's also acting through other receptors that are involved in pain, inflammation, metabolism throughout the body, these TRPV receptors and also the PPAR receptors within the body. So CBD is quite different. CBD is, a very pleiotropic compound. It acts on about 65 different receptors, enzymes, and neurotransmitters within the body. And, traditional medicine would say that this is a dirty drug. Most drugs that we know that have activity across a range of different areas often have increased side effect burden related to that increased activity at these different receptor sites. But CBD is really a well-tolerated shotgun, so to speak, where it has a lot more side benefits generally than side effects. I'll have people coming in using CBD for pain, and they go, well, it hasn't actually made much of an impact on my pain, but it's my, anxiety's improved, my skin's better, my digestion's improved, and they have improved well-being, but their primary complaint may not have been as impacted with CBD as you'd like. So it's a great foundational medication, but then you can add in these other compounds and cannabinoids to make it a more powerful treatment. So, it's this network pharmacology across a range of different receptors that shifts the internal state to a healthier place. So this is just a picture of CBD's receptor activation and inhibition. And generally, with CBD, the more you use, the more effective it is, so it doesn't have that same sweet spot that THC has. And, it can take, a couple of weeks when you introduce it before you actually start getting some of these benefits as well, because some of the activity is through these PPAR receptors, which are inside the cell on the nuclear receptors inside the cell, and they affect gene transcription and have downstream effects on inflammation, immune modulation, metabolic effects, and that takes a couple of weeks before those effects really start to kick in. So as you can see, a wide range of potential benefits, and it's not necessarily going to have huge impact at each one of these areas, but it does have anxiolytic properties, it does have anti-inflammatory analgesic properties, it can be has positive long-term benefits in regards to brain health, in cognition, it's neuroprotective. So, a good general lubricant really for a lot of different conditions. And it's pretty well tolerated, some digestive complaints, sometimes a little bit of change in energy or fatigue, but it is an extremely well tolerated medication. But the biggest issue probably with CBD is when you need to use high doses of it, it becomes costly. So that can be a limiting factor for patients. And if they are on a lot of other medications as well, high doses can lead to medication interactions as well, because it's metabolized through the cytochrome P450 enzymes within the liver, which is the main pathway for metabolizing a lot of drugs and other herbs and other compounds as well. So, we can group, cannabis into these ratios of CBD to THC, so high THC, low CBD, balanced formulations, or CBD predominant formulations. But now with, selective breeding practices, we're getting type 4 strains that are high in CBG and others as well. You might hear patients talk about indica or sativa predominant products. That is meant to be based on their morphology and their origins, but really it's being used more commonly to infer effects. So sativa strains are generally more uplifting, cerebral, motivating, energizing, but they can probably be less impactful for pain, and they can sometimes be more likely to induce anxiety, whereas the common indica ones are traditionally more sedating, relaxing, better for muscle spasticity, and have a much more sedative profile as well. In Australia, this is our categorisation system for cannabis. So category 1 through to 5, category 1 being CBD predominant, category 5 being THC predominant. Unfortunately, when they made this categorisation system, they didn't really have an awareness of the minor cannabinoids and the role that they play as well. So we have this weird situation in Australia where all the minor cannabinoid profiles, even though they're not intoxicating, even though they're low risk, they are actually category 5 products as well in Schedule 8 medicines, which seems a bit ridiculous to me. In the States, when they have a hemp-based classification, it's about the THC percentage, and that's appropriate because THC really is this outlier, powerful, therapeutic drug, but also has that higher risk profile. So, we use these things in combination as well. And so by adding THC, like I said, to the CBD as the foundation, that can make it a more effective treatment. By adding CBD to a THC-based treatment, it makes it more functional, more tolerable. It reduces the intoxicating profile of THC. It reduces the anxiety associated with THC. It reduces some of that clouding of executive function that can come with THC as well. And they work through different receptors as well, so there's a therapeutic depth that is increased when you have them in concert. And in regards to chronic pain, the majority of the evidence is around these balanced profiles, so a combination of CBD and THC where we have good impact on pain, but also functional and tolerable as well. And we can use them to think of it through that lens of daytime versus nighttime. So CBD and the minor cannabinoids are very functional, generally help with working memory, cognition, verbal memory and recall, so they don't have that same clouding of executive function. And THC, which you can incorporate to do the heavy lifting or to use more predominantly at nighttime, where it reduces some of that internal rumination, slows down the brain and allows people to prepare for good quality night rest. So one of the hard things about studying cannabis as well is that really the best results come with these whole plant medicines, and it's a synergy of these compounds. Even even these constituents in trace elements make a difference, and this is known as the entourage effect within cannabis. But the entourage effect was actually coined by a famous Israeli researcher, Raphael Mechoulam, when he was looking at the endocannabinoids, anandamide working in concert with PEA. That is the traditional entourage effect where PEA and anandamide worked in concert to have much greater effects than either one alone. So I incorporate PEA, in pretty much all my pain patients, but across a wide range of my patients when I'm using cannabis as well, because they do work so well together. So looking at it through this lens of the endocannabinoid system, how do these compounds actually interact with this system? So CBD is a gentle upregulator of the endocannabinoid system because it inhibits the enzyme that breaks down the endogenous cannabinoids. So that leads to a slight uplift in the overall functioning of the endocannabinoid system without any risk of causing a dysregulation or downregulation of that endocannabinoid system. THC is more of a direct stimulant for the cannabinoid receptors, which means it can have very powerful effects. But being a plant compound, it's only ever a partial agonist. The synthetic cannabinoids that are like full agonists of these receptors are actually quite dangerous. So the plant compounds actually modulate themselves by only having partial agonism effects. But even too much THC, when people are using it with the idea that they need to be intoxicated to get the benefit, over time, will actually downregulate the endocannabinoid system, and that makes it harder for them to respond to challenges and stresses in real time. So we want to be working, if we are using this plant and we are using THC, we want to make sure we're doing it in a way that supports the endocannabinoid system as well, and that's by having personalised functional goals and getting them to engage in these other modalities. That's where we get the results. But we don't want cannabinoids to replace the endocannabinoid system. It's there to support it and to give patients an opportunity to engage in other endocannabinoid system upregulating activities. So looking at the evidence for cannabis and chronic pain, cannabis is a challenging drug to study through a conventional randomized controlled trial sort of model, which is where they're trying to limit as many variables as possible. It's a single molecule that acts on a single pathway for a single condition. People aren't like that. Most people have multiple comorbidities, and the reality is even in those limited models, that's probably not actually what's happening to most medications. But cannabis is challenging because it is this heterogeneous group of compounds. It needs to be applied on a personalised basis to get the right dose for the individual. And it's a hard drug to blind as well, especially with THC. People generally know when they've had the placebo versus the active drug. And there's been a huge, because of the legal sort of framework around cannabis, because it has been seen as a drug of misuse and abuse and a prohibited substance for so long as well, it's also made these types of trials very challenging, being a naturally occurring medicine as well. It's a non-patentable medicine. So the vested interest from drug companies is not there to actually develop this research. What we do have is huge amounts of research trying to prove the harms of cannabis over the last 100 years, where people are using it in a very dysregulated recreational manner. And even people who are abusing cannabis for prolonged periods of time, yes, there are harms, but they're not that terrible compared to other things like alcohol. But there was a study that was done in 2017, and I still think it's probably the best study around cannabinoids through the National Academy of Sciences, Engineering and Medicine, that showed that even with this, when they're looking at specific RCT data that has adequate power, that there is pretty good evidence around cannabis for chronic pain. And and it's not just improving the pain, it's this pain interference as well. And the reality is there's not many interventions that or drugs that we use for chronic pain that actually have that much evidence behind them, especially for chronic pain. Opioids are ineffective and dangerous for chronic pain. Paracetamol, the evidence around it is pretty low. Anti-inflammatories you can only use for short periods because it leads to a whole bunch of GI issues and kidney issues and blood pressure issues. And neuropathic pain medications are only helpful for a very selective group of patients. So the evidence behind cannabis for chronic pain is probably better than any other sort of pharmacological intervention that we have there, and it is generally better tolerated. There's reports of adverse effects, and one of the main ones is euphoria. Is that a problem? I don't think so. But yeah, so the evidence is pretty good. Obviously, we need more data, and the randomized controlled trial data is not always the most appropriate data that we look at. Real world evidence and large observational trials are likely much more appropriate for these types of applications. So we do know that there's a greater understanding of the endocannabinoid system. This is a system that's had 25,000 sort of papers published on it in regards to how important it is for a range of different health and disease processes. We have a lot of preclinical evidence, a lot of animal study models, and we have some really compelling real-world evidence, large observational, longitudinal type studies. Unfortunately, they never get included in any meta-analysis when you're looking at these drugs. But there was one done here in Australia where they had patients who were not currently self-medicating or regular users of cannabis who went through an appropriate clinician-led titration to find their optimum dose and their appropriate profile for their particular condition. And the results were, really quite profound. Obviously, there is a bias in this. There were patients who probably didn't respond, who didn't continue on with the trial. But I'm not saying that cannabis is going to be beneficial for everyone, but it can be beneficial for, a good portion of the patients, and because it has a relatively high safety profile, it's worth trialling. And for those who did stay in this study, this is older adults. The primary presenting complaint is chronic pain, often with some other comorbid sort of issues. Most of them were using a balanced type long-acting formulation. And if you look across a range of different sort of domains, there was statistically significant improvement in regards to their overall health status and functioning. There was improvements in their insomnia severity index, improvements across their depression, anxiety, and stress scores. The pain interference, once again, I think is the thing we're looking at there. It's not about reducing their pain score, but that pain interference and how it impacts their life, and just their global impression of feeling better from both a patient and clinician standpoint was generally improved. And those benefits were sustained over that 2-year period with very few to little to serious adverse events over that time. So in Canada, they've been a bit more progressive in the cannabis space for quite some time. This is their guidelines around cannabis-based medicines compared to other medication interventions like opioids, saying that the evidence is good enough to say that cannabis should be used preferentially over drugs like opioid-based medications, based on the fact that there's decent studies that improves not just the pain, but all of these other secondary sequelae of living in chronic pain, so sleep, anxiety, and just overall sort of well-being. So, one of the biggest issues we've had, out there managing chronic pain as well is patients being prescribed opioids. There's no malicious intent around that. Doctors are generally wanting to alleviate the suffering that their patients are going through, and they just have limited tools. But, that unfortunately leads to tolerance and escalating doses, which leads to worsening functioning over time and potential sort of mortality and morbidity associated with that. And the endogenous opioid system and the endogenous cannabinoid system is co-located throughout the body. And a small dose of THC or a subtherapeutic dose of THC and a subtherapeutic dose of opioids have been shown in different mouse models to actually create a therapeutically effective combination. So by using a little bit of cannabis, you can actually enhance the effectiveness of someone's opioids. You can reduce their dose without reducing their benefits that they're experiencing from these opioids. And a lot of the time, you'll have a significant reduction in someone's opioids. Sometimes it's complete cessation, but generally there is, a capacity to down titrate these other drugs. So pain, as I said, is not just a physical thing. It affects every aspect of someone's health and well-being. It changes their entire worldview. It changes the way that they view themselves. And using medications that just focus on one particular part of that pain pathway is not going to give the results that we're hoping for when we're implementing these things. So, cannabis, when used correctly, used with proper guidance, with proper intention, with personalised goals, can not just help with the pain, but it can help with a lot of that other functioning. And as the last presenter said, if you can get someone sleeping well, if you can improve their quality of rest, they have so much more tolerance for the challenges of the following day. Their emotional bandwidth is improved, their capacity to function even in pain is going to be improved. So regulating someone's sleep alongside dampening down their pain is going to have huge impact on their overall well-being. So, we need to, like I said, provide these functional goals. We need to engage in these other activities. It's not just about, here, have a drug, and that's the end of the story. That's just the start of the story, and that's where you guys come in to actually create the wellness picture that we want our patients to be living in, rather than a disease management state that unfortunately many of them are trapped in. THC is a powerful medication, but it can be a crutch. It can be used to distract and deflect the distress of the world. And, for a short period of time, that might be appropriate. But in the long run, that's going to stop them, from having a full and meaningful life. The pressures of life will still be there, even if they've blocked them out for a period of time. So, if we are using THC, it's, do it in a way where I'm going to use it to actually help me go out and do exercise or go to therapy or do some journaling or do some reflection, because it can actually, that perceptual shift that comes with the potential intoxication with THC, when leveraged, can actually be a powerful therapeutic tool. If we manage someone's symptoms on a daily basis, that's good medicine. If we change the way that they view the world in a positive manner, that's pretty powerful. So, leveraging that, looking at having a layered approach to prescribing as well. It's not just about here's some high THC flower, smoke it when you feel like it. It is about having a layered dosing protocol, looking at the daytime versus nighttime, looking at the specific problematic expression of their condition that each individual has, and tailoring the therapy around that. So I'm often using 2 long-acting formats and 1 or 2 inhaled formats for a lot of my patients, and that's where you get the best results with this precision, prescribing pattern. Just, as you guys aren't prescribers, I'm not sure whether you know the landscape here in Australia, but all doctors can prescribe cannabis. In Australia, there's special access pathways that exist, and doctors can become authorised prescribers. That means that they don't have to do individual patient applications every time. But these are unapproved medicines still. They're not registered on the ARTG because they don't have that evidence base around them on a per product basis. So patients need to have tried other first-line therapies. And so, I think that's appropriate for many things, but, I don't expect all my patients to have to cycle through opioids, neuropathic pain meds, benzodiazepines to get there. We have to have considered them simple analgesia and other, like physiotherapy or osteopathy or exercise physiology adequate to, have a justification for using these compounds. So, there are precautions with all of these things. I won't go into these in too much detail, but, can't use cannabinoids in pregnancy and breastfeeding. Not that there's a high risk associated with it, but there's just a lack of evidence. Traditionally, when we look back through history, cannabis was actually used a lot through pregnancy and birth to actually help as an analgesic. Through that birthing process, it also increased improved the contractility of the uterus and improved sort of labour progression as well. So, but, we can't prescribe them in these conditions at the moment. If people have fragile mental health, unstable mental health conditions, we need to use certain compounds with caution, primarily THC, but CBD actually has antipsychotic properties and at high doses performs as well as antipsychotic medications from reducing those pro-psychotic experiences, but much better in regards to the negative experiences around psychosis and much better tolerated as well. If someone has unstable heart disease, we need to use THC with caution. If they have a high falls risk, there can be some balance impairment that comes with, high doses of THC, so we need to be aware of these things. And, driving is still an issue here in Australia for our patients when they're using THC-containing medications. So even if they're legally prescribed cannabis, even if they're not impaired, if they register a positive swab test, they can still get done for DUI, which is just an absolute travesty for, Australian patients when we have such a poor, public transport system. And, we do need to be aware of different medication interactions as well, because, they can interplay, but the reality is the medication interactions, there's a whole range of potential interactions, but the reality is those interactions are generally not clinically significant and don't shift other drugs outside of their therapeutic window. So just in summary, thank you for bearing with me. I think I nailed that on an hour. Use the endocannabinoid system as a focal point for holistic healthcare. It gives you this, an overarching system that helps the body adapt to the other therapies that you're implementing. Cannabis is best suited for patients who do have complex chronic health where there's, often comorbid presentations because it works across all of the different sort of areas of impairment. Utilize, the complexity of the plant rather than using isolated compounds within cannabis. There is this herbal synergy, and there is a capacity to tailor these treatments to the specific individual as well. It needs to be done as a functional medicine with personalised goals in an interdisciplinary framework. That's where we get the real benefits, and that's where we support the body's own endocannabinoid system, because ideally we want people to be able to get off any of these exogenous tools, any of these therapies, and their body's own systems and their regular activities are doing the job of keeping them healthy and well. The evidence, does need to be improved upon, but there are many limiting factors around it. But the real-world evidence is really quite compelling when we're using high-quality medicines in a personalised, clinician-led scenario. Yeah, and that's all from me today.